Did you know that a recent decision could lead to 14 million more deaths by 2030? And it's tied to health aid funding cuts. This information came from the Lancet, which is a reputable medical journal. This article was published just a few weeks ago on June 30th. And this research shows that when countries like the US cut back on global health aid, it doesn't just impact other nations, it has a ripple effect that affects us all. My name is Amy Gill. I am your pharmacist that cares. And because I am your pharmacist that cares, I believe in health and wellness just isn't about pills. It's about people, prevention, and policies that protect life. This is not a political issue at all. This is about prevention all over the world, about health and wellness. Disease does not know borders. It is so important that we realize what these cuts are doing all over internationally, and like I said, and how they will affect us as well. Public health is global. By these cuts, we're going to increase the risk of infectious disease outbreaks. By not providing vaccines, we're going to see increases in things that are preventable, such as polio, infectious disease like malaria, tuberculosis, HIV and AIDS. All these things are going to be on the rise, which is going to increase mortality. We must be prepared by staying on top of these outbreaks. Why? Because if we can prepare for where these outbreaks are starting, we're going to prepare and hopefully prevent the next pandemic. This is a global issue. Disease outbreaks will disrupt international markets. They're going to affect the supply chain, and they're going to affect us all. Because of our recent trip that we just got back from Africa, I mean, yes, it was an amazing trip. The safaris, unbelievable. But on the way to those different places, those different national parks we were going to, we would drive through the villages. And I have seen the pictures. We've talked about clean water before in a couple of my episodes and what you can do to help give these people just the basic necessities of life. And I've seen the pictures of the children carrying these yellow containers to the river to get dirty water. But to actually see it in person as we're driving along, these little children, you guys, I mean, they're probably like maybe 5 years old. The jugs are almost bigger than they are. And they are walking mile after mile. Because I was asking the driver, I'm like, where's the water? Where are they going? And we would drive quite a ways before we would get to it, and he would show us where it is. And then you would look and you would see these children filling up these jugs of dirty water, where people are also there washing their clothes in the exact same water. There are animals drinking from the exact same water. And of course, probably voiding in the water, right? If they're there, they're animals. These things, like I said, to actually see in person really has such an impact on you. There were so many different things that we saw, but these children, everybody, they're so happy. I mean, they're on the side of the road, they're waving at us. They're so happy to see the tourists because that's a big income for them. And they were just thrilled to see people that are there in their country. But to think next time we visit, 14 million of those people are going to be gone. There might be a lot of those faces that aren't there waving at us on the side of the road because of these cuts. It is so important that we take care of everyone. We are privileged to be born here. We didn't ask to be born in the US. They didn't ask to be born in the country that they are from either. We need to help everyone because by helping them, we are truly helping us. Like I said, disease knows no borders. It is important that when you're looking to give to certain organizations that you find ones that are reputable, because yes, of course, there are ones that are corrupt. That's the way it is, unfortunately. But there are so many organizations that are good, that do good. When we were in Africa, we made a lot of contacts with people, have their information, and we know ways we can actually get these things to the right people and in the right hands. So that is what I'm asking you. I am asking you to be part of this global effort to really realize what we do here matters all over the world, and what happens all over the world affects us here as well. It is so important. And like I said, as the pharmacist that cares, I really do. And there's no borders for my love and caring of people. Like I said, if you would see these little faces, you would see exactly what I mean. We waste So much stuff here. We would, when we were on our safaris, they would pack up lunch boxes for us, because we'd be gone all day. And we stopped, and before entering another area, it was kind of a picnic area, and we ate. And the food, there's so much food in these boxes. I mean, because they're made the same, no matter if it's for, Alex, or if it's for my husband, or Liam. I mean, they're the same size of, same amount of food, and you just can't eat it all. So Alex was eating, their chicken was in a lot of them, and they was all wrapped in foil, and he had eaten a lot of his food and one piece of chicken, and really wasn't going to finish the second one. And our guide said, Alex, are you done? Are you going to eat that? Because he was kind of like, starting to wrap it back up. And he said, I'm full. So he said, can I have that? So he took the remaining food that we had left and actually gave it to somebody else there. That it's just mind blowing to me, absolutely mind blowing. We had another thing happen when we were doing our hike to base camp at Kilimanjaro, and our guide was carrying the lunch boxes in his backpack. So we stopped. We ate a little bit at one of our first stops on the way up, kind of condensed a little bit, and then went up to the base camp and ate some more because we were hungry. And again, we had chicken and, all those things. Well, we were kind of, putting the bones in one, and he said, just, put all the good food in one, and let's put the, the trash in the other. And a salt and pepper packet. You guys know exactly what I mean. Those come in all those plastic silverware packets, right? Or you pick it up when you're, at your local fast food place, right? Those are in your bag. And I don't really add extra salt, maybe sometimes pepper, but I don't really add it. And I wasn't going to use it. So I went to throw it in the one with the trash. And he looked at me and he said, can you please put that in the one to save? And I mean, I will never look at a salt and pepper packet the same way again. Even that, which I guarantee you all have probably thrown one away this week, he wanted it saved because that is even precious to him. And once we finished our hike, got down to the bottom, we ended up having one box of remaining food from the four of us, and he took it home. That was what he was going to have and probably share it with his family tonight, or that night. So we just need to realize there are people out there that do not have things. We really take this for granted, and this cut in funding is huge to them. This is all about disease, malnutrition, all these things. So what my ask is for you today is to look into how you can help. Reach out to me. Like I said, I have a lot of information, and we as a family are actually going to do something on a bigger scale. So reach out to me, please, and I will be happy to give you the information on where we can get these items and how we can help these people all over the world, because we are citizens of the world. There are no borders. People are amazing. They are so happy and so welcoming. You just have to see it. I don't know what else to say other than you have to see it, but it has made a huge impact on my family. So please help us, help them,